Hi, this is Mark, instructor at Red Mountain MCC Center, taking you through another workout. The equipment you'll need, preferably, is dumbbells, a bench, or you can use a floor, a tube, surgical tubing, and a mini band, preferably. If you don't have these, we can improvise those somehow. So what we're going to do is go through a thorough warm-up first. And the saying goes, if you don't have time to warm up, you don't have time to work out. So we're going to start with a foam roller. This is for what we call soft tissue work. Helps with the mobility by breaking up adhesions in the muscle tissue. So and there's several different ways to use this or routines. I'm going to go through one and follow along with me. So I'm going to start off with my quads, my thighs, and I'm going to be in kind of a low plank position. Nice and easy. I'm going to push and pull with my shoulders, rolling my thighs and my quads across the roller here, creating a little compression into that tissue. This can be done for however long you like, depending upon what your time schedule is. Usually I don't go more than 2 to 4 minutes with this. And then an optional area is the side of the thigh, crossing the top foot over so we can take some of that load off the roller. Go nice and easy. This is going to be a real sensitive area. Some people refer to it as the IT band area. We'll just call it the side of the thigh. Again, if it gets to be painful, raise up a little bit with it by pushing that top foot in the floor. Take some of that load off. Now I'll go to the other side. Apologize for turning my back to you. And then I'm going to hit my hamstrings. I'm just going to place the roller into the back of my thigh, slightly above the kneecap. Going to use my arms and shoulders to raise my hips up off the ground. And again, using my shoulders, going to use a little bit of a sawing motion so that I'm pushing the backs of my legs up and down the roller. What I'm going to do next is try and utilize a little bit of balance. I'm going to sit on this roller, going to slightly roll so that I'm on the left glute only, or most of that pressure is coming down into my left butt cheek. Just hitting a real small area right in there. And I'm going to come over, do the right glute. Again, this doesn't take much range of motion. Nice, short, sweet area that we're trying to affect. And the area that we want to make sure we're doing this right on is the upper back. And this is the area that really feels good. Basically, we're just giving ourselves a massage, applying pressure using body weight. So with this, we prefer not to go into that lumbar section of your spine. Keep the roller from maybe bottom of the rib cage. Roll as high as you can up on the shoulder blades, having your hips up off the floor. The feet will be providing the movement as you push and pull with the feet, rolling up and down. If you want to hit a more of the lat, the shoulder blade area, just slightly roll it to the side. Raise the arm above your head this way. Come back to the other way. Then a little added bonus with the roller is what we call thoracic extension. So the upper spine area, we call the thoracic section. I'm going to support my head, not allow my hips to rock forward, not allow my back to arch forward, my low spine to arch forward. And I'm going to take my shoulder blades and head back a little bit try and get a little bit of extension through that area. What happens if you're sitting a lot during the day, we end up getting into a shoulder forward, chin forward position. We want to try and reclaim that good posture. So that's what the purpose of this is. Again, don't get bored. This is just our warm-up, our preparation. A few deep breaths. Okay, good. Now for some activation movements. And again, we're getting the body ready for some work. So we're going to do some glute bridging, hip bridging. We're going to keep the feet solid on the floor. Think about good solid pressure through the heels into the floor. We're going to extend at the hip. We're not going to arch the back. Raise the hips up. Get a good squeeze here. Just go to 180 degrees at the hip. If you can get that, no further, and back down. I'm going to do 5 of these. Then I'm going to go 5 single leg versions to progress this, warm up a little bit. Switch. 1, 2, 3, 4, 5. Now for a dual purpose movement, going to be a hip bridge march. I'm going to keep my hips up, solid, not going to change my pelvis angle on my stance leg. I'm going to bring one knee to my chest and down. I'm going to alternate. And 5. Then we're going to do some planking, and we're not going to spend a lot of time here. This will be part of our workout. We're going to incorporate core work, people call it. I like to call it torso stability work, in with our strength exercises. We're going to do this just briefly in this position. Maybe 10 seconds. And then relax. I'm going to go on the side, come up. This does take a little bit of shoulder stability, shoulder strength. If you need a modification, you can bring your heels back to your butt, bend the knees, and have your knee as your support point. Relax, I'll go to the other side. Apologize for turning my back to you. Again, maybe 10 seconds or so. And good. Okay. One last warm-up piece I'm going to do. I need to find my green band. I'm going to do a little warm-up movement with my hips, for my hips. Abductor walks, mini band walks, sometimes they're called monster walks. So what I'm doing is I'm putting these around, or putting this around my instep. Makes it a little bit easier to get on and off. I'm going to go a nice lateral high knee walk one way, maybe 4 or 5 steps, keeping the knees apart. If you just want to do a 1 step one way, come back the other way, that's fine too. You don't need to have a whole lot of room for these. Just trying to get these hip abductors strengthened and warmed up a little bit before we get into our strength portion. Okay, our first pair of exercise, I'm going to wheel the bench in here. I've got access to dumbbells. If you don't have access to equipment, do a push-up variation. Previous video gave you 3 different types of push-up variations. So what I'm going to do is I'm going to do 10 repetitions of a dumbbell bench press. I'm going to do what's called an anti-rotation hold, or a Pallof hold. I'm going to alternate those for 4 sets to move on to another set, a pair of exercises. And I'll be explaining these as we go. Lost my transmitter there, sorry about that. I'm going to give you a side view. So you can see an angle here. So we're going to go first set, I'm going to go 10 reps. Eight, 9, and 10. Set those out of the way. An anti-rotation hold is exactly what it says. We're going to get into a position, surgical tube, some type of mini band, TheraBand, or a bungee cord. Okay, I have a low attachment here because I have to use the bench. I don't have any other attachment point. I'm going to take this tube, I'm going to hold it out right in front of myself. The tension in the tube is wanting to pull me. It's wanting me to rotate. Okay, I'm not allowing it to do so. So I'm staying nice and solid here. And I'm going to go 10 seconds or thereabouts in this direction. I'm going to go 10 seconds in this direction. You may be thinking, well, you're not moving. That's right. So the tension of the band wanting to pull you, you're resisting that tension. That's still work being accomplished. So it doesn't need to be it doesn't need to be movement occurring for work to occur. And we'll see that as we get into the further plank holds. So that was anti-rotation. I'm going to come back to dumbbell bench. Going 10 reps again for the second set. If you're using dumbbells and you find you're having a hard time setting them to the floor, bring your knees up to you, set the dumbbells here, and rock up in one movement. I'm going to take my band again, go into my hold. I'm having to breathe on this. You do want to breathe when you're holding these. If you need to increase the tension, you would step away. If you need to decrease it, you would step closer. I'm going to go the other direction. So I'm working obliques on both sides. 3, 4, 5, 6, 7, 8, and 10. Good. Going for the third set. Still looking to get 10. If the dumbbells that you have don't allow you to get 10, anywhere from 6 to 10 is going to be fine. Anything less, you may want to change it up. is put a knee and a hand on the bench. Okay, so we've got real good support. I'm thinking a long spine, keeping it in a neutral position. I'm not going to look up. I'm going to keep my normal cervical spine in line with the rest of it. I'm going to have a little bit of a protracted shoulder blade. I'm going to bring my shoulder blade back and just do a rolling motion with the dumbbell. Okay, I'm not going to, or we're not going to go into torso rotation with this. We're trying to affect just the upper back scapular movers. And 10. Okay, gonna come on the other side. Hit the other side for 10. 2, 3, 4, 5, 6, 7, 8, 9, and 10. What do we have with this one? We're going to go with the left side plank. It's the same position we had in our warm-ups. Going to be on our side and up and hold for 10. I don't know about you, but I'm sweating pretty good here, so definitely doing some work. And calling that 10 seconds. Excuse me while I adjust my transmitter one more time. I'm going to come on the right side with this. and 10 seconds. Okay? I'm going to go with the kettlebell. Kettlebells are a little bit more user-friendly. The weight comes out through the wrist, and you can get a regular grip on them. So again, I'm trying to keep minimal shin angle from occurring. Spine stays straight. I don't want to roll the shoulders. I'm not trying to reach forward with it. I'm just letting my arms slow down to the ground. Come back up. I'll do 2 more here. And 2. That was the second set of Romanian deadlifts, or stiff-legged deadlifts, sometimes they're called. Go back in the right side plank and come up. And 10 seconds. Again, the planks also allow us, again, as stated before, to just let the area that we're working on recover a little bit. Ideally, your recovery time for a strength exercise of a muscle group is anywhere from 60 seconds, could be up to 3 minutes, depending upon how intense you're going and what exercise you're doing. A lot of times the answer is, it depends. Okay, sliding hips back, spine straight. I'm not locking my knees though, I'm allowing them to kind of move at the knee as my hips come back. And we'll do one more here. Good, that was my third set of Romanian deadlifts, kettlebell Romanian deadlifts. Third set of right side plank. If you've been doing side planks, you may have noticed that one side might be a little bit steadier, stronger than the other, and that's common. We're not symmetrical beings. I'm going to give you a different view here. 1, 2, 3, 4, 5, 6. I'm going to do 2 more. And 8. Good. Last set of right side planks. Then we're going to go into our stretch recovery period. And coming up here. 2, 3, 4, 5, 6, 7, 8, 9. And good. Good work. We're going to take maybe 30 seconds here. I'm going to wipe off my sweat. I'm going to pace around. I'm going to show you a few stretches. And we're going to go enjoy our Friday afternoon. Okay, so with these, instead of affecting one joint with a simple static stretch, we're going to try and get into a position that affects multi joints and try and have a little bit of movement occur with it. So this one, we want to do the pretzel, is called. Going to be tilted over on one hip. That hip is going to be bent at 90 degrees. The knee is going to be at 90 degrees as well. Top hip is going to be extended here. We're going to be trying to affect this part, and in the upper back, back knee is at 90 as well. I'm going to have my hands underneath my shoulders here. I'm going to be on my hands, staying in kind of a high position. This seems to hit some different sticky areas on me. I'm going to apply light tension and pull with my hands, so I'm getting some rotation with my upper spine. For some people, you might find that this is a little bit better position, or it's affect in different areas. Or you can kind of just play with them and use a hybrid. So we're doing deep breathing with these. And anywhere can be 10 to 20 seconds. The switch come back the other way. On my left hip, tilted over, left hip 90, both knees at 90, right hip extended. I'm going to be affecting this hip flexor, opening this area up a little bit. And good. Next stretch. I'm going to stay in a seated position. I'm going to cross my right foot across my left. I'm going to try and stay as straight through the spine as I can, which creates a little bit of anterior tilt at my pelvis, kind of pulling my pelvis forward, affecting this left glute a little bit more. I'm going to hug